All right. So you should be able to see my screen. As a reminder, as usual, if you're not with the school systems or the health department, we'll ask you to drop off the call and watch for the slides and presentation to be shared online within the next few days. Make sure any needed information is passed on through your school system as needed. Just a reminder, upcoming, the meeting on December 23rd and December 30th, which are Thursdays at 1 o'clock, will be canceled unless there is some important information or something. We'll keep you posted. Just a reminder that on the 9th of November, MDHHS did issue an advisory for mask use in indoor settings. So that's not a mandate, but an advisory. So we would ask as much as possible to encourage mask use in indoor settings. There really has not been much additional resources put out for that, like signs for your workplace or the building. We've asked if that can be provided to help you out with this. These are really the only two resources that have been put out by the state, which were social media graphics that they shared, but I've shared them here if you want to copy them and use them for anything. They're available on the MDHHS Twitter feed. But again, just to continue recommending masks rather than stating they're optional or not required would be a big help to try to slow the rise of cases in the state. This is a copy and paste from an email that was sent out to the health departments. Just have some reminders for antigen testing availability. It was just a reminder that if schools contact us with help with supplies for antigen tests, to refer you to the school ordering form. If we have some available and you're really in a crunch, we can give you some. But just a reminder to use the school ordering form. They're reminding us, and so I'm just passing it along, to make sure and allow about 2 weeks for processing. If you are really in need of them because you're having an outbreak or something, make sure to note that when you're ordering them so they can hopefully rush that ahead. Try not to order more than a month's supply at a time just because of the expiration date issue. Reminder that reporting of positive test results is a federal requirement. And then a couple weeks ago, it was brought up the question about, if you've lost your reagent, the liquid in the bottle, or you need more, there is contact information here of how to get a hold of Abbott, the company, to get more for that. So just wanted to pass that along. Also, hopefully you've gotten this message forwarded to you already, but just a reminder, Major Uller is the coordinator now statewide for testing, and they're going to be starting the school testing updates again. So that first call is on the 7th from 11 to 11:30. I'm including the team's call information here. If you need that forwarded to you in a different way, just let me know. But hopefully that information has made it to you otherwise, but I just wanted to share that. This is just some different information on holiday safety tips. It's from the Public Health Communications Collaborative. I put the link there. This is just one handout on that page. They also have it in Spanish, and they have some social media posts and other information as well. So if you want anything to have on hand for that, that information is there. I just wanted to pass on some information that's been shared with us, a little off topic for COVID, but I think we're all aware of the recent shooting in Oakland County. These are some resources in case you are noticing some needs within your facility that have to do with some aftermath from that. I added at the bottom the OK to Say website that has information and posters and things encouraging people to anonymously report any concerns they have, because, you know, I think there was some, at least I'd read there was some talk that there had been some suspicion that this might have happened and it wasn't reported. So just to encourage students and let people know how they can report that kind of concern ahead of time. So for your county data, I would refer you to the mystartmap.info page. I'll go through the 5 through 18-year-old data here in a minute. Everything's pretty much dropped off, but I will mention, and it is mentioned in some of the state data as I get to it, we typically do see a drop off after weekends, but also after holidays like this, because people tend to not go in and get tested, and there are delays in labs getting test results done and reported. So it's hard to know if some of these decreases are true or just delays from the holiday weekend. So this is our 19 county area. The counts, I did add in last week's counts as well, even though we didn't have a meeting. So just so you're aware, that data point is in there. The orange line again is the same week of the year for last year. So the counties in Central Michigan District Health Department, first is Aranac, then Clare, then Gladwin, then Isabella, Osceola, Roscommon, then the counties of Mid-Michigan, Clinton, Gratiot, Montcalm, and then District 10, Crawford, Lake, Kalkaska, Manistee, Mason, Mecosta, Missaukee, Newaygo, Oceana, Wexford. Going through this week's data and modeling update from the state, I did go back through last week's as well, and there really wasn't anything different or new. There's quite a bit of information this week to share, so hopefully it won't take too long, but I don't want to rush. So Michigan remains in high transmission. Our percent positivity, unfortunately, is increasing again. Our case rate continues to increase. We have the second highest number of cases for any state in the United States this past week. Our pediatric case numbers, which for them in this statement is those under 12, has increased 2.6% in the last week, which is slowing a bit. The percent of inpatient beds that are occupied by those with COVID is 20%, and it's been increasing for 18 weeks. In the last week, we've had the highest inpatient bed utilization and the 7th highest ICU bed utilization. Our pediatric hospital bed census has gone down just a little bit, but close to where it was at the highest point throughout this year. Our death rate is increasing over the past week, and 439 people died of COVID between the 16th and the 22nd. And we've had the 6th highest total number of deaths in the US for any state, and the 14th highest death rate, so deaths per population in the country. So this is our case rate, so the number of cases per the past week per 100,000 population. As you can see, I threw a line in here just to show you we have hit numbers significantly higher than where we've been over the past year. Again, there's this drop off here at the end, which may be because of lack of testing and delays in reporting from the holidays. We'll hope it's a true decline, but we may see it rebound back up over the next week or two. And they make a note of it here on the bottom. So the percent positivity has steadily been increasing. Inpatient bed use has continued to steadily increase. The case rates increasing, and again, this bit of a drop here, but it may be delays in reporting. And our death rate seems to be leveling off, but is still very high. We've been showing comparisons here of this time of year compared to last year, hoping that we did not reach our holiday wave of last year, but we are pretty darn close to it now. So this Delta wave that we've been in since August has just continued to rise. Our age differences are starting to narrow. As you recall, this from beginning of school year, the 10 to 19-year-olds really took up the bulk of the case rate, but now the differences between age groups are starting to narrow. The highest just here towards the end of this reporting period has been the 30 to 39-year-olds. For our healthcare system, there's a lot of strain. 10.5% of all emergency room visits were for confirmed COVID cases. The hospital admissions for most age groups are plateauing but are very high. So that's admissions. The census overall has increased 13%. It was 12% last week. So again, it's kind of leveling off, but still increasing. The ICU volume has increased a bit, but again, it had a large increase last week when we didn't have a meeting. On average, around 7 people for every million people in our population are dying per day. The population over 60 that are dying has been increasing some. So again, this is the amount of people in the ER just for COVID. So we're getting close to the peak that we had in the spring. I put a line here again just to show this is our hospitalization. We're basically where we were in the spring. Unfortunately, we've had just this really long climb, so it's been a long, painful surge on our hospitals rather than this quick increase, decrease. So they're really getting burned out in our hospital systems. And our ICU, same thing. It looks like our ICU COVID, and this is just COVID, census is just starting to get higher now than it was in the spring. This press release actually just showed up in my inbox just a few minutes before this talk, so it was just released today. The Michigan Hospital Association was reporting that 3/4 of all COVID patients in the hospital are unvaccinated, 87% in the ICU are unvaccinated, and 88% of people on a ventilator are unvaccinated. So they're really encouraging people to get vaccinated because it definitely does make a difference in preventing infection, but also preventing hospitalization. And as I mentioned, our hospitals are really, really running out of room for people who are sick. So this shows our hospital census. This dotted line is where we peaked off in April, and as you can see, we're just starting to blip over it. The yellow are the number of people in for COVID. The blue are the number of people in for other health reasons, and we're just running out of room. And if we get to a point where we have to go to crisis care, that's where we start making choices as to who gets a bed and who doesn't, or who gets a ventilator and who doesn't. These are our pediatric hospitalizations and PICU stays for COVID alone. So again, reaching the levels that we saw in the spring. This is a little change. They looked at the COVID cases in rural versus urban areas. There's always been worse illness or worse deaths in the rural areas. but this is specifically just for Michigan. So these green lines are, they name them in a funny way, but are less urban, more rural areas. So per population, we have more cases in those areas. The absolute numbers obviously are lower, but we are struggling more in these areas with caseloads. This is an illustration of vaccination rates, urban versus rural. I don't know why they have Montcalm County colored here in the urban or the large metro area, but that's the only county in this area that's in the low range. The rest of them in the large metro counties, they have a moderate to high vaccination rate. The smaller counties or the less metropolitan areas are in the moderate vaccination rate. One is low, but then when they go to the non-metropolitan or rural counties, everybody but Leelanau pretty much are in the low to moderate. So, that's kind of their way of saying that rural areas have more cases and lower vaccination rates. For age, the orange line is the rural areas and the blue line are the urban areas. Older ages tend to have similar vaccination rates, whether they're urban or rural, but for the younger ages, which are under 65, the rural areas is where we start to see the vaccination rates dropping off. So that would be your parents and your teachers. This is just an updated data table on our breakthrough cases. We're still seeing that about 15% of cases are breakthrough. I'm sorry. My mouse has gone crazy. Okay, about 15% of our cases are breakthrough cases. This is averaged since January. Certainly the breakthrough cases were lower in the beginning, and now with Delta, the breakthrough case rate is a bit higher because it is just so much more contagious. That's really why mask use is so important right now. But still, your odds of getting ill and hospitalized and ventilated and dying are dramatically lower if you are vaccinated. Nationwide, you have about a 6 times lower risk of getting COVID if you're vaccinated and a 14 times lower risk of dying if you're vaccinated. In Michigan, it's about a 4.5 times less risk of getting COVID and a 9.3 times less risk of dying. Michigan, I just checked before this talk, we're number 30 in terms of our percent population that's fully vaccinated in the nation, which is likely why we have a bit lower numbers than nationwide. In terms of outbreaks, there were about 93 new school outbreaks this last week. Just get right to the graph. So I did add in last week's as well. I went back to that report. So we continue to have ongoing outbreaks and new outbreaks. It's all pretty stable, and same for the number of cases. So that continues to be about the same. Just a brief discussion on the Omicron variant. It does have a lot of mutations, as shown in this image. We really don't know definitively if it's going to make it more resistant to treatments or to vaccination or more contagious or anything like that. We know that new variants are going to form as the virus spreads. It's a guarantee. That's just how the RNA viruses are. So expectations are that the vaccines should still work. If anything, maybe a little less effective, but really it's too soon to tell, and they really are looking at this closely. This is as of this morning. It was last updated yesterday. It's in probably 25 countries at least. We know it was found in California yesterday, and they had not yet updated this. So it's in 26 countries. Likely it's in every country, just about. It's probably just not been found yet. and it will eventually make its way around the world. So this is information that the state did put together. What they are saying is that it may be more transmissible. There may be an increased risk for reinfection. We do know that the PCR tests that are in use will detect the infection. What I've been reading from the CDC, though, says that we really just don't know quite yet. So time will tell. I did find these websites. It does list every antigen test and PCR test and allows you to check by variant if the test will still work adequately. Currently, I mean, everything we're using will work. It does not have Omicron on there yet, but just in case you ever had concerns or you got questions from people, this has a nice table and a nice way to check, you know, how the tests work and confirm that they will work on different variants. Because again, it's pretty much guaranteed we'll continue to get new variants. So this is just a slide that the state and U of M put together, basically showing what we should expect over the next several months if nothing changes, and the improvements we could see if more people got vaccinated or if people started to wear masks and started to self-isolate a bit more. Basically, it's the effect we had, you know, when we had lockdowns last year, but, you know, this year we'd have to do it voluntarily. Just an update, there was a large influenza, it was influenza A, H3N2 outbreak at U of M from October 6th to the 19th of November. There were at least 745 cases identified. Around 26% of those cases were vaccinated, so the rest were not vaccinated. So it'll be interesting to see, you know, after the holiday break, if any of that has made its way to the rest of the state. So the big concern here after my discussion of what our healthcare system is looking like, back when we had a more normal flu season, because last year our flu season was extremely mild, you know, we see a lot of hospitalizations and healthcare utilizations and deaths from the flu each year. The flu vaccine, when its uptake is normal, does prevent a lot of hospitalizations and deaths. Right now, our flu vaccination uptake is behind normal for this time of year. So again, just a reminder that a couple of our meetings will be canceled given holiday breaks. That is the end of my talk for today. Let's see. All right, I'll get to the questions here. If you have any questions, please share them in the chat. And at the end, we'll open up to questions by phone if you happen to not be on your computer. So first question, who can we contact if we don't have the Teams invite with Major Uller? What I'll do is I'll ask that when we send out the materials from today's talk, that we also send out that information. It'll be in the slides as well, but I'll make sure we specifically put that in that information. Okay, put myself a note here. Would you recommend school districts or other employers who have fully vaccinated staff members that have been identified in COVID positive exposures to be able to work if testing negative on a daily basis? So it is still the recommendation that if someone is fully vaccinated and a close contact, they do not have to quarantine, so they can still work. I do know there's been concern because of the number of breakthrough cases. So you certainly can test them each day and certainly have them wear a mask. But again, if they're fully vaccinated and a close contact, they can work regardless. But again, it is recommended that they wear a mask for 14 days after exposure, and it is recommended they get tested around 5 days after their exposure at a minimum. Again, if you would like to offer them testing on a daily basis, you can do that, but it's not required. With yet another variant coming and probably more to come, what are your thoughts on eliminating the quarantine altogether if staff is a close contact to a positive person but tests negative? Thinking risk versus reward, as we need staff to be at school to serve students. So of anyone who's most likely to get infected, it will be your staff, and they would be the most likely to spread it. One thing, I mean, I always say this, but if they're vaccinated, they don't have to quarantine at all. I know that you have some that are probably a really hard sell on that one. They also, in our modified quarantine plan that we have provided, we do allow for staff to follow the modified quarantine plan, which was basically what was being described previously, where they can test to stay. So for the first 7 days following their exposure, when they work, if they test negative on arrival, then they can stay and teach. But again, you know, teachers are the most likely to get infected and spread it. I think big things are to continue to review the need to get vaccinated, the need to wear a mask, and the need to stay 6 feet away from students as much as possible. Because again, if they're not a close contact in the first place, then it's not an issue. I know those things are challenging, but I do know, you know, from having family members that have worked in the education system, you know, there are things that can probably be done to sort of reduce those risks of exposure and reduce the chances of people having that 15 minutes or more of exposure. We continue to work with the state and the nation trying to get better data and better guidance on modified quarantine and changes. So, do staff need to have the booster to be considered fully vaccinated? No. The definition of fully vaccinated is the same. It's just that primary series, whether it's a 2-dose series or one with Johnson & Johnson, 2 weeks after the final dose, you're fully vaccinated. The booster is recommended for everyone over 18, and depending on which vaccine you got, determines the timing, 2 months after Johnson & Johnson and 6 months after the other two. But it's not required to be considered fully vaccinated. You're just more likely to get breakthrough infections the longer you go. All right, so let me unmute everybody. So I think I muted people. So if you hit *6 on your phone, you can unmute yourself. Trying to see if I can do it. Otherwise, if you have other questions you want to put in the box, you can do that. Any other questions? All right, well, we'll get this material out to you and we will forward the call information from Major Uller. And if any questions come up in the meantime, let us know. And thank you guys for all your hard work and perseverance through all this. So have a great rest of your week and great weekend.